So today we do have Cathy Pratt talking about when behaviors occur at school. The session will be for families will learn about the functional behavior assessment process, including what it is and when it should be done. The process will be described, including how it relates to IEP goals and behavior support plans. Cathy, thanks for coming.
Thank you, Melissa. So the title of this is When Behaviors Occur, and I'm the director of the Indiana Resource Center for Autism at the Indiana Institute on Disability and Community. And one of the reasons that we picked in this series this year the topic of behaviors was based on feedback that we got through our needs assessment survey, where we found that parents who had children who were suspended or expelled or on reduced day didn't know about an FBA if there had been an FBA done. So I thought that would be a good opportunity to educate you all. This is not going to be an incredibly detailed or extensive, but it'll give you some information about the FBA process. So an FBA should be conducted under the following conditions. When your child with a disability has engaged in significant behaviors that interfere with their learning or the learning of others, that it's not an isolated event, it's not just something that happens once and then is done, that there's a pattern of behavior. If your child has been suspended or expelled repeatedly or placed on reduced days, then and it's because of behavior, honestly, at that point, I would be requesting a functional behavioral assessment be done. So what is a functional behavioral assessment? I'll kind of go through some of the steps involved in it, but overall, what a functional behavioral assessment starts asking is the question, why is this person engaging in the behavior? So it looks at the relationship between a person's internal environment and external environment and the occurrence of problem behavior. So what I want you to understand, first of all, is that behavior is not all within a child. Okay, there's not bad kids. Instead, behavior is related to context, to environment, to interactions, to skills they've learned. And so that's one of the reasons that it's not unusual to see that kids may act very differently at home than they do in the school setting. That is not an unusual problem because there are different contexts and different expectations. So remember that behaviors are really symptoms, and we use this iceberg because what you see in terms of behaviors are really just the tip of the iceberg. And really behaviors are a symptom of larger issues or underlying conditions. And so in reality, we do not merely treat the symptoms. A symptom is the child is hitting, a symptom is the child is kicking, a symptom is the child is withdrawing. What we treat are the underlying conditions. And it's those underlying conditions that we try to identify through the FBA process as well. So I really believe it has to be a team process, and family members, you're a part of that team. You know, it should be the learners, teachers, the related service personnel, paraprofessionals who are spending a lot of time with your children should give input on the process. And the learner with ASD, you know, a lot of times we forget to ask the individual what's going on and get their insight into the situation. But there should hopefully be some kind of a coordinator of the FBA process who pulls all the information together, but all should contribute. You know, and when I go in and do consultations like my colleagues, we go in and we observe and we ask questions of a lot of different people to get different perspectives on an issue, on this behavior, about what's going on. So the first step in it is that we have to identify the behavior, okay? And we operationally define it, and my preference is that I want to know every behavior that the child is engaging in. Again, we're not treating behaviors, we're treating the underlying conditions of the behaviors, and this hopefully will become clear as we go through. What you have to be careful about is that oftentimes when we do definitions, people impose a lot of judgment. So this child is just doing this behavior to get out of work. But why are they trying to get out of work? Is the work too easy? Is it too hard? Is it non-preferred? What's going on with that work? So we want to be really careful to remove all judgment. So it has to be operationally defined so that we all know when we see it, and that it can be both accurately addressed and measured as well. And part of this is also that the team should choose their battles. And I know that all of us have hot button behaviors that maybe upset us a little bit more. The one that I talk about is that I have a hard time with whining. And when my grandson would whine to me, he realized that that was not the way to my heart, that it really was best if he didn't whine. Now, whining is not a behavior that should warrant an FBA process. But I think that we all have to understand what our triggers are and what our hot buttons are, because part of the equation is how we react in all of this as well. And again, you should assist in that process of identifying the behaviors as well. So identifying interfering behaviors, operationally define and remove all judgment. Child hits with open hand causing red mark. You would know that if you saw that. Child bites self on the arm, breaking skin. Student says no and puts head down on the desk. Student responds to staff with profanity. So those are all good definitions of behaviors. Here are some that are not so good. Being aggressive, non-compliant, tantrum, hyperactive, angry. I know when I am angry, really angry, I have a tendency to get quiet. Other people throw a chair across the room, And I really struggle with the definition of non-compliant, because what does that mean? What does that look like? Does it mean that the child says no when presented with a task? So we have to be able to all see the behavior and understand it. And so that's even a task for you all, is to get consistency in the household about what behaviors you're addressing. So once the behavior is operationally defined and there's consensus that it really is a behavior we need to focus on, then it's really time for the team to start working on identifying both antecedents and consequences. So there's two different types of antecedents that we can see with individuals, and I will explain those and give you examples of them, and I'll give you a grid that kind of shows you how this lays out. The first one is called slow triggers or setting events. And in the Indiana IEP, we talk about them as precipitating factors. In the next antecedent are fast triggers, or those are immediate events. So you get up in the morning, and there's no coffee in the house, and you're a coffee drinker, which, by the way, would not make me happy. And then you go into your car to get ready to go to work, and the gas tank is on empty. That somebody in your family didn't fill the tank up, and you don't have any money with you. And so by the time you get to work, you're probably a little agitated and maybe not as calm and able to cope. Those are setting events. These are things that you may or may not see that set your child up for behavior difficulties. So when people say to me, the behavior just seems to happen unexpectedly out of nowhere, a lot of times that's because of setting events that we haven't seen that sets the child up to becoming a little bit more irritated. So they may happen in or out of the school or classroom context. Again, it's the conditions that increase the likelihood that behaviors will occur. So all of these are setting events for our kids. Anxiety, we know anxiety is a major one. Recently I've seen a number of adults who have gastrointestinal issues, so biological issues. And I remember years ago seeing a child who was having some behavior difficulties, and it ended up that he had rotted teeth. So always we want to look at if there's any medical reasons or any biological things going on with the individual. Just the neurology of having an autism spectrum disorder is going to be a precipitating factor. And then if that individual has had trauma in their life, trauma because of strategies that have been used, trauma because of loss that has gone on, trauma because of the events of the last year, all of those things can have an impact on behavior. And then we see schedule changes or staff changes can cause some challenges for our folks. And I know in schools right now that they're having a hard time finding full staffing, and so there's going to be some changes in that. Medications that are changed or missed can have an impact on behavior. And I really encourage you to work with the school team when you are looking at changing medications, because I absolutely disagree with physicians who say, don't tell the school that there's been a change in the medication. Make sure the school is prepared and understands. I also found that as a classroom teacher, so often I would have students who would have behaviors and then a couple days later would become ill. So impending illness is also an indicator for our kids. Missed meals, excessive hot and cold temperatures, and especially with some of the sensory challenges that our folks experience. Arguments or fights with classmates, parents, teachers, difficulties on the bus. And then this is the one that I really want you to hold on to, is the idea behind skill deficits. And we're going to talk more about that later. And home conditions. And when I say home conditions, I don't mean that it's bad parenting. It's not a criticism of you all. It is just that, especially going through this pandemic, there has been a lot of family stress. Economically, some households have struggled. We know that there's a higher divorce rate amongst families who have children on the autism spectrum. So these are all going to be precipitating factors for your children. And then past or current experiences with school. If in the past there have been punitive approaches used that caused some trauma for your child, that can also be a setting event. And then we look at fast triggers, and those are things that are directly related to the challenging behaviors. They immediately precede the behavior. So we know that if a fire drill goes off, that the child will have a behavior. Okay, we know that there are conditions that when they present themselves, it's immediately going to trigger a behavior. And those are things like a child being teased or bullied. And a lot of times our kids don't know the difference between being teased or bullied. They can't make that distinction. It can be an assignment or a curriculum that is too difficult or too boring or too easy. It can be a specific type of task or activity. For example, we know that paper and pencil activities are oftentimes difficult for our folks. It can be a specific request or wording of a request. As a teacher, I had a student who hated the word no. And every time somebody said the word no, she would have behavior challenges. We know that there's individuals who do not like praise. And if they're praised, that may actually trigger behavior. Certain noises, again, like fire drills or too much chaos in a setting, or certain people, because of their tone of voice or the way that they interact with the child, can have an impact. Unstructured time is a major one, and so one of the things when we look at behaviors is that we look at how to tighten up the schedule. The behaviors of others, if kids are in classes with other kids who have a lot of behavior issues, that may be a trigger, and then transitions. So consequences, the only definition of a consequence is that it follows a behavioral response, antecedent, behavior, consequence. Too often we think about a consequence in terms of punitive approaches, but if you're looking at it from a behavioral perspective, the only definition of behavior is that it comes after, the only definition of consequence is that it comes after a behavior. The only definition of reinforcement is that it increases a behavior. The only definition of punishment is that it decreases a behavior. So the reality of it is, for some of our kids, suspension and expulsion, the ability to go home and play on their video games, is actually a reinforcer for them. For some of our kids, as I said earlier, praise may actually be a punisher for them. It's not something they want. So the only way that you know that if something is a reinforcement or punisher is that it increases or decreases behavior. So this really asks the question, what is the payoff? What is the motivator for the behavior? What is maintaining this behavior over time? And we use a tool oftentimes called the motivation assessment scale. I'm not going to go into depth with this if you want to see it, but basically it asks a series of questions to find out if the behavior is related to sensory input, because we know that kids engage in behavior because it may give them some sensory input. I will see that sometimes with self-injurious behavior. I've been around several individuals lately who engage in self-injurious behavior, and there's a sensory component. Some individuals use their behavior to escape or get a break from something. Some kids use their behavior to get attention from others. And then there are those who use their behavior to be able to access something that's a tangible item. So how do we collect that information? You have this PowerPoint so that you can look up these links, but there are questionnaires, and I include these two questionnaires because one is the Lagging Skills Inventory by Ross Green. What I love about this is that it gets us to look at what are the skill deficits that are related to the behavior. And the second one is the Ziggurat Strength and Skills Inventory. And what I like about that is that what's resonated with me is that too often when we sit down and we talk about behavior, we only focus on the deficits. But if I can understand what your child's strengths and skills and preferences are, then I can start developing a program that is more holistic and really builds that child up and helps them to be successful. We interview key people, and you should be one of those key people that get interviewed in the process. We will do record reviews, and some of your children will have pretty extensive records. We will do observation and data collection, or there should be observation and data collection, and that's really to show trends in behavior and to really remove judgment. So an example of a data collection tool that we use is something called the scatter plot. And what I love about the scatter plot is that it's very easy to use in a classroom setting. It is not disruptive. It combines a key. And so here we can see the blank spaces are when behaviors are not happening. The X's are when the behavior is happening at a higher rate, slash marks at a lower rate. So we can start seeing the patterns. And so, for example, we can see arrival's good, PE is good, recess is good, prep to go home is good. But we want to see on those days where we have fewer behaviors going on, like day 4, what happened on day 4 that helps with that behavior. So too often we make judgments about behavior. I want to see the data. And I think as parents, it's realistic that you ask to see that data as well. And then I will put something together called a problem behavior pathway. And I'm going to include a really easy one here for you to look at. And so that I can explain it a little bit to you, the concept. So this was a child who would scream at classmates, push classmates into walls and lockers. Her sudden events were that she had anxiety and depression. This is a very simplified version of this. She had challenges with social skills. She really wanted friends, but she didn't know how to make friends. And she had pragmatic communication difficulties, so she had a hard time telling people what she was really thinking and feeling, and so she would act it out. The triggering antecedent was when she saw classmates violating rules around private behavior, and she believed that in a school setting that students should never ever hold hands or hug or kiss, that was private behavior and that was not meant for school. And I don't know how many of you have been in a high school, but that behavior happens. So what she got out of the behavior, what maintained it, was that she got some staff attention, she got students to stop for the moment, and because she was sent home, she was able to escape school. As a matter of fact, at one point she went into the office and said, "My parents are busy today until 10 o'clock. Just told the front office staff that, and then she was good until 10 and then had a behavior outburst. So the analogy that I use, and I apologize if you've heard this before, but we get a paycheck from IU, all of us on this call. It used to be a paper paycheck. It was red and white. And if my boss had come to me and said, "Cathy, in order to get your paycheck, you're going to have to do a flip," he could have screamed at me. He could have docked me pay. He could do whatever he wants to me, but this body's not going into flip position without heavy machinery. And sometimes we focus so much on the consequences, the punishment. What are we going to do to this child so they stop doing this? That we forget that we have to address the skill deficits. If the individual doesn't know how to do better, they won't do better. So Ross Green says, if students knew how to do better, they would do better. And so he really has gotten us looking at this whole thing around skill deficits. And we know that the only way to change behavior in the long term is to teach a child a different way of responding, provide them an alternative behavior or skill. So this is a more typical one. Again, you've got this in your handout. And for this one, I started adding the strengths and skills because if I can understand those situations under which a child is successful, I can start building those into programming. And I think, again, we focus so much on deficits, and we really have to kind of turn that page and understand a little bit more about the strengths and interests of our folks as well. So components of a behavior support plan, it may need to have a reactive plan. So I like to use the term de-escalation because I think too often when we think about crisis, in schools, school teams are trained in crisis strategies, or they should be trained in crisis strategies. But the goal is, if I know that I'm going to be getting a student who has the potential to do property destruction or to hurt staff or do something, I should be having a conversation with everybody involved about what the de-escalation plan is or what the plan is to keep everybody safe. And families, you need to understand that plan as well. We also need to make sure that we identify the desired skills, and I'm going to talk about that a little bit more in a few seconds. We should talk about instructional strategies that work for your son or daughter and how those are going to be embedded, and those become part of the positive behavior support plan. The reactive plan is just that, a reactive plan. Everything from desired skills down is part of a positive behavior support plan. and environmental adjustments that need to be made. If your child needs to be in a smaller setting, or if they need to have their desk located someplace else, a reinforcement plan if there's a token economy that's going to be used, or how the child will be reinforced in knowing that they are doing something appropriately. We always have to build in some kind of a reinforcement plan. If there's any kinds of accommodations around testing or around participation, those should be part of it. And then I think also, I like to always think about with school staff, what are the additional services for training that the school staff need? And then bottom line, oftentimes I will talk to families about family support. So the Medicaid waiver, are you on the Medicaid waiver? Hopefully all of you on this have signed up for the Medicaid waiver. If you are pursuing other options or services for your child, do you have respite services for your child? What else is going on so that we can start supporting you? As your child becomes the age of 14, is there a transition plan in place? And have you been working through all of the financial ramifications of that as well? So we want to make sure that as part of that behavior support plan, we're also talking about family support as well. So changing behavior in the long term is going to require, again, teaching alternative skills or replacement behaviors. So some of the replacement behaviors that I think about are problem-solving skills, choice-making ability, anger management, relaxation, self-management and control, communication, which is, to me, is a major one. We know that there's a very tight link between communication and behavior. And, my bias is that the communication program should not simply be about how many minutes of speech therapy services your child gets a week. It should be about how we build a sustainable communication system that is going to follow your child into adulthood. And that's the question. And if that's the case, then we all participate in communication. Social skills, emotional regulation. We see a lot of kids who have difficulties with emotional regulation, and some of that is tied to some of the sensory issues they have. And then resilience. And I think it's really important that our kids develop resilience for the long haul. And that means that sometimes they are going to have to learn how to lose. They're going to have to learn that they're not always going to be first in line. So we don't want to accommodate so much that we accommodate them right out of possibilities. So here's some not good IEP goals. I want you to hold on to these. When asked to complete work, the student will comply. When upset, student will not hit other students. Student will manage conflicts. But what skills do they have to do that? When asked to do something he does not want to do, the student will not make derogatory comments. So these IEP goals are based on, hopeful outcomes and on what we do not want the student to do. Okay? An IEP is about the skills that we will be teaching children. So a good IEP goal, for example, when shown the incredible 5-point scale or some other self-rating scale that depicts different levels of feelings, emotions, student will identify the correct feeling emotion on an average of 80% of 3 weekly trials. This was an IEP goal that was established for a little boy who had some incredible behavior. He would tear things out of the wall, he would urinate on the floor, and we were trying to get him to the place of identifying his emotions and doing some emotional regulation. And so this was a first step in this process. So in this situation, when I think about this, during independent reading time in language arts, Audrey makes noises, talks out, and walks around the room. The FBA has shown that this behavior is maintained by adult attention. So for this situation, what is the best replacement? Ask to sit at the teacher's desk during reading, raise hand and ask for a break, request help adult attention, ask for a reward for completing the task, request an easier task. It's request help because what we know is that the behavior is maintained by adult attention. So you want to choose a replacement behavior that the child will help the child participate and get attention, and you want to give them reinforcement by giving them that adult attention as well.